everyone. Welcome to my IVF and welcome to the European Fertility Society and welcome to our webinar tonight. I'm glad that we are back with another topic to discuss and another expert with us. As you can see, our guest is here with us already, Veatriki Tsatsouli. I hope I said that correctly. And thank you so much for joining us tonight. It's lovely to have you here. And how are you feeling tonight?
Well, I'm great. I'm happy to be here with you. It's a great opportunity, to share our experiences and give some tips, if possible, to our friends.
Definitely. Our topic tonight, as you can see, is what do you need to know before embarking on IVF journey? And of course, Veatriki is here to help you out with some tips. She has a presentation on this particular topic, but as always, remember that we will also have the Q&A session, which is, I think, is the best and probably your favorite part of the webinars. And of course, remember that you can type the questions in the chat and then Veatriki will be happy to answer them for you. So don't hesitate. Anything that's on your mind, we are here to support you. We are here to answer any of your questions. And as you know, we've been here for a while now, and I think that European Fertility Society and my IVF are simply here to encourage you to ask, because we know that if you're asking the right questions, you will be educated and you will be able to simply have the best answers as well, and then it's easier for you to make up your mind on what to do next, of course. And as you know, we are here almost every single week, and we've been here for many years right now, and I'm very happy that we are able to continue with our work, and we are able to continue with and able to invite all the fertility experts, but also coaches, psychologists, and it's amazing that you've been able to come here as well, and I know that it's going to be already useful for you. And before we start today with our presentation, I also want to ask, and maybe someone that would like to help us and volunteer. As you know, we are still looking for some volunteers. We are looking for people that are able to help us with some transcriptions. So if this is something you think you might be up for, I will put my email address in the chat, and go ahead. And of course, you can ask anything. I'll be happy to give you some more answers on that as well. And I think that right now we can start with our webinar and our topic tonight. I hope you are ready. It's great to have you. And ready to begin?
Let's start.
Brilliant.
Okay,
Thank you so much indeed.
Thank you too, Carolina. Well, first of all, I would like to tell you a little bit about myself. I have been working in the fertility sector for more than 15 years now. So I really know how it feels, to try so hard, to make a baby through fertility treatments. Carolina, I have an issue. Just give me a chance, please.
Sure.
I cannot see my presentation.
Okay, sorry. Just give me a second.
Okay.
Yeah, here it is.
Okay, that's perfect. That's perfect. Okay. So, actually, I've been saying that I have been working with patients for many years, so I can feel in a way how difficult it is, to go through the procedure. It's not an easy ride. So I think I have chosen some of the things that I believe it's important, and things that they can probably help you in your fertility journey. Okay. So let's check it out. Okay, so taking the first step in IVF treatment is always, it's maybe not always, but most of the times it is a bit difficult. Many women, many couples, when they reach to that point, when they realize that they face a fertility difficulty, they hesitate to go forward. They delay their treatment. They are not sure that they are they are ready to start, they feel that they still have time. So this point is very crucial for going forward. So some of the important things that will help us go through this and make this, a bit more easy, is first of all, to try and educate ourselves about fertility treatments. Why is that? Most of the fear and the anxiety that comes with IVF stems from uncertainties about what will happen next, about the processes, about the potential risks. So the more you know about your treatment, the less stress you will feel. In this case, we always advise the patients to never, hesitate to ask the questions they have in their fertility specialist, in their treatment coordinator. Uh, you know, uh, this is the main reason we are here, to answer all the questions and all the concerns a patient may have. The more you know and understand the process, the less stress you have, and the more safe you feel about what are you going to do next. So this is actually very important. I need to point out, though, that even though internet is a very valuable source of information, sometimes before we start our treatment, can add extra stress and anxiety. So it would be great if you choose trustworthy sources, and if you try to take informations more about the steps and the processes, and less about personal opinions. What I've seen is that even though there are some basic and same reactions to the treatment, every treatment is different, and every woman, every couple is different. So the way we see fertility treatments differs from one to another. Okay. Another important thing while we're trying, to make our first step, is to be aware of the importance of the age in fertility treatments. As we all know, fertility declines after the age of 30, so 35. Every month, a healthy, fertile 30-year-old woman has a 20% chance of getting pregnant. This percentage declines a lot when we will be around our 40s, for example, where 5 out of 100 women will reach that goal. This is important because actually age is our basic enemy in a way. We don't, when we delay treatment, waiting for the perfect time, sometimes it costs us. So when we will reach to the point that we know that we need help to have a baby, a fertility treatment to have a baby, it's good, to take it step by step and make the decision. It's the chance that we need to take at that point if we really want to have a baby in our lives. So this is an important issue that we need to keep in mind. In fertility treatments, we also hear a lot about the importance of patience. I know that it can be irritating, to tell you that be patient and everything will be done, you will make it and everything. Nevertheless, for us, it's important because, as I said before, IVF is a step-by-step procedure. So, and sometimes it take a while, to get to to your goal to have a healthy pregnancy. So when we are prepared for that, and when we understand that on time, we have really managed to empower ourselves in order to handle any difficulty that may appear easily and better. Okay, so stay focused to your goal, and be patient in a way to try and understand the situation, and don't get disappointed when a difficulty appear. uh, Also, choose someone who is supporting in order to be with you in that journey, besides your partner, if you have a partner. It's not what's good or what's right or what's wrong. Choosing a friend or a family member to trust, to talk about your fertility issues. It's not always easy. Friends and family can be a great support, but sometimes can be even the worst. Okay, so it's a personal thing. Actually, you will do what you think best, of course. But if you have a person that really can stand by you, and be normal around you, have the time to listen to your concerns, and be when you will need him or her, it would be great. Okay, keep in mind that there will be people around you that they will react in a way that you will probably don't like, or they will make you feel a bit uncomfortable. There are people that are a bit insensitive, or they don't know how to handle you, don't know how to handle a situation like that. It's not like they do it on purpose, but those people cannot really help you through the whole procedure. So try and avoid any kind of situation that will make your life harder at that point. You don't have, to be guilty about not wanting to share. If you don't want to share um, your feelings or your treatment detail, it's something that you will do for yourself. Try and do and be kind to yourself, uh, and feel as much relaxed as possible, in order to be able to cope with the things that you'll need to cope during the treatment. Other things that are important, another thing that is important, I'm so sorry for that, is additional help when needed. Research has shown that psychological stress experienced by a woman with infertility is similar to that coping with to that of women coping with cancer or HIV or chronic pain. So we know, and we can understand that our emotional health, our mental health is very, very, very important. So getting support from a psychologist, from a psychotherapist, can be really helpful at that point. So don't hesitate to ask for help if necessary. Uh, it's advisable to ask for professional help, to visit a psychotherapist with your partner if you feel that this will help. It's better to do that early than later, when problems may arise. It's not always necessary, but if you feel that you need support, go ahead and do it. It will definitely help. But other things like our overall health, it's very, 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 very important. Okay, before you start treatment, it's good to manage any health concerns you may have, such as diabetes, such as high blood pressure, obesity, thyroid disorders, or other chronic conditions. In our clinic, we always advise, to have a cardiological assessment before treatment, especially for women over 45. We also ask for a mammogram and breast echo for women over 36 yearly. And of course, annually, your pap test. I understand that those tests are not always, easy to do in many countries, but it is very important because we have to keep in mind that we do not only want a healthy baby, but we also want a healthy mother. So it's important to be sure that our health is good and that we are indeed ready, to proceed with the treatment. We hear quite a lot of things also about normal weight. It's very important. We face quite a lot of difficulties with weight nowadays. A BMI over 35 is as harmful to yourself as it is a BMI below 19. Both conditions negatively affect our ability, to conceive. So it is an important issue. Fertility specialists always point out how we have to control our weight. So if you are in either category, begin rethinking your diet. Try to follow, a realistic plan, a realistic diet plan, an exercise program that you can stick to it, and keep your mind on your goal. It's not only what your fertility specialist teams will do for you, but it's also what you can do in order to help yourself. And those are some important issues that you need to take care so you will have the best chances for a successful treatment. Fitness, of course, is essential. The American Heart Association encourages a minimum of 30 minutes per day, a minimum of 5 days per week. Sorry for that. This will benefit your health, your overall health, and also increase your chance of a positive outcome on your treatment. You don't necessarily have, to exercise, to go to an exercise class or a gym. You can choose an activity where you can raise your heart rate, make you breathe faster, get some exercise in your daily life. This will totally improve your chances of success, of IVF success. Smoking, it's a no in fertility. You already know that. Quite a lot of people do smoke, and we totally understand that it's not difficult to quit smoking. Nevertheless, it's necessary because it really affects the quality of eggs and sperm. Boost sperm health. Of course, it's not important only for women to follow advices, but it's also important to encourage our partners, to follow the doctor's recommendations. Sperm health is very important, so maintaining an optimal BMI, having exercise in our lives, and also trying to do our best helps improving sperm quality. Of course, when it comes to male infertility, you should advise, and you could advise your fertility specialist regarding male fertility supplements. It would be a good idea in many cases, and of course, when and if needed. Okay, so what happens when time comes and when we are ready and we are just a step away to start our treatments? I think it's very important, first of all, to follow your doctor's advice. Your fertility specialist will decide about your medication, when you will need to take it, if any changes need to be done, when you will do your oocyte retrieval, your embryo transfer, etc. For these decisions to be made, your doctor has considered quite a lot of factors like your age, like your menstrual cycle regularity, your ovarian reserve, your medical history. So choose your doctors wisely and trust them. You know, it's very important for the treatment to follow your doctor's advices. Uh, there are cases where, you know, doing your own thing was really, you know, bad for the treatment. Um, it can really mislead the fertility team and it can negatively affect the outcome of the treatment. So trust at that point is very, very, very important. Uh, be prepared for changes. Every treatment is different. That's true. Uh, Expect the unexpected. Infertility treatment, it happens. You know, many patients says, "Why me? Why do you have to wait? Why that happened to us?" But actually, um, in it's something that really happens. You know, especially when your team works with individualized protocol. You know, um, so in every step, in every uh, stage of the treatment, things may happen. You know, there are possibilities for failure when the treatment starts. If your hormonal profile is normal to start, if there is the cyst or not, if we have a poor response to the medication, if we have no fertilization or no blastocysts at a point. There are difficult times that you may meet. Uh, Difficult times when you will need to wait for your final test result, your BHG result, or the day of the day of the final testing. Nevertheless, uh, you must always think positive as possible, as positive it can be, in order for you to be able to handle the situation uh, as calmly as possible. Side effects, this is something that may occur, not in everyone, but you know, due to hormonal treatment. Feel prepared. You know, you must probably feel, you will probably feel, you know, more emotional. uh, Maybe you will have some minor physical side effects like pressure, cramping, or bloating in the pelvic area, some breast tenderness, baby, but not something very special, you know, just a discomfort. In many cases, IVF can cause also ovarian hyperstimulation. Of course, nowadays, with the protocols our doctors use and with the testing, we uh, totally avoid those situations. Um, so nothing that you should be afraid at all. You can live your daily life as normally. You can go to work. It's not paid. It's not painful at all. But you just, you know, need to do like your schedule appointments and has a daily routine regarding your medication according to your doctor's advices. Um, You should also be very well informed about the risks that comes with an IVF treatment. Many patients asks us or wants, to transfer more than one or two embryos. You should know that having more than one embryo implanted during IVF raises chances of getting pregnant with multiples, which increases the risk of premature labor and other complications. To reduce that risk, in our clinic, we advise a single embryo transfer. This is something that you should discuss with your fertility specialist before embryo transfer, and I'm sure you will take the best decision according to your doctor's advice and your medical history, and what you personally wish, of course. Um, at least, but not last, I think that it is very important, to stay positive, but also, realistic. Experience tell us that, women under 35 have highest success rates, but for conceiving, um, both natural and with assisted reproductions, but that doesn't mean that you will not get pregnant even easily sometimes. Be mindful of the factors such as age, weight, lifestyle, habits, and your general health. All those factors will determine the success of your treatment. So stay positive, stay confident at your respective IVF journeys, and be kind to yourself. It's not easy. You can handle it. I'm sure you can handle it. It's a chance that if you wish to, you must take. That's it. That's the things that I would like to point out, and I will be very happy, to discuss with you or to answer to any questions you may have.
Great. Thank you so much indeed,
Mhm.
for your presentation, for all the tips you have provided. You have experience, you have done in this, you have been working in fertility field.
Mhm. Mhm.
And I think that this is on point, and I believe everyone was able to find this
Yes,
very
yes, yes.
useful.
We deal with.
Sorry, I didn't hear that, I'm afraid. So if you can repeat.
Yeah. Okay. Yeah. So we had an issue for a moment. Okay.
Okay. Now I can
I
hear
have
you, so
heard
it's
you
okay.
too, Carolina. Okay.
Now it's all
Okay.
okay.
Perfect. So. Okay. Great. Uh,
Sure. I mean, right now, of course, this is time for the questions. So if you have any, there are some, of course, right here. There are some ready. But if you have more questions, go ahead, type those in. Veatriki is here to help you out. So ask anything, and I'm sure she'll be happy to help you. So let's
mhm.
have a look. Let's have a look at the first question from Liz.
Okay.
Do you recommend seeing a dietitian? I have gotten different nutrition advice from naturopathic doctors in terms of what to eat to increase equality. So I am considering seeing a dietitian. Anything you can say on that?
Yes, Liz, yes, this is always a great idea. Having a diet plan, it will be very helpful in order to have all the necessary nutritions that will help you in your fertility treatment. Of course, that doesn't mean that eating healthy will increase our egg quality. So we cannot wait for miracles at that point, but it's definitely helpful. And we also advise to see a dietitian specialized in fertility that will help you, to follow a great diet program. Yes.
Thank you so much for that question. And if I may ask another question in regards to this, so do you at the clinic do you cooperate with any dietitians or
Yes, of
nutritionists?
course. Yes, yes, yes. We have a dietitian. So uh, and every patient who wishes to, they can take advice, or even though their BMI is normal, we provide advice on how to have a healthy diet before, during, and of course after IVF treatment. It's very important because we are preparing for pregnancy, so diet play a role.
Okay, good to know that. Thank you so much for answering my additional question
Mhm.
as well. And as you can see, there's a thank you from Liz for your answer as well here. Thank you a lot. Emma has another question for you. So, the first line testing before IVF, what to check if the first attempt was negative, the second line testing before IVF? Anything you can add on that?
Okay. Okay. So, okay. I totally understand the questions. Of course, I'm not a doctor, I'm not a fertility specialist, I'm not a clinician. The first time, the first line testing before okay. Uh, when the first attempt is negative, normally your doctor will give you some advice in order to proceed to further testing. The tests, of course, never end. Okay, there are, and also testing after first failure depends on your age and your medical history. Okay, so it's not the same for every couple and for every case. The best person to advise you properly is your fertility specialist. So if you had a failure, then an appointment is necessary with your doctor to be able to discuss about your treatment, what you did, what maybe went wrong, what can you do best before you proceed to another treatment. It will definitely need some extra testing though.
Okay, thank you so much, Emma, for your question. I hope that was helpful. And as always, I just like to remind everyone that remember that, of course, it's always best to share your medical history with the team at Assisting Nature, for example, as well, and that way they can provide you with the details, right? So this is always
Mhm,
the case.
mhm,
Thank
mhm.
you so much for your answer to this as well. Okay, Emma has another question. So, do you think it is worth to try acupuncture before IVF? Is it offered at the clinic? It's more and more popular, I
Yes,
guess,
yes,
recently, right?
yes. Of course, it's helpful. It's very helpful actually. Many patients wish to have an acupuncture treatment before their embryo transfer. We do have an acupuncturist, and we can provide, treatment with acupuncture. Of course, there are different programs that you can follow. Some of our patients start acupuncture before even they come to Greece for treatment, and they do about 3 to 4 sessions when they are in Thessaloniki for the final stage of their treatment. But yes, of course, we would say yes to that. We totally agree to everything that can really help us improve, the way we feel and the way also our body reacts. So yes, it's a yes, definitely. Thank you, Emma,
Excellent.
for your question. Mm.
Indeed, thanks so much for that. It's good to know as well. Okay, Sarah has a different question. Have you any tips during treatment? I struggle with migraines.
Oh, okay. Yes, migraines. Yes, that's an issue. That's true. Acupuncture helps, though. Many women suffer from migraines. Acupuncture is a treatment that may help you. It works in many cases. We totally believe that exercise also helps, trying to be more relaxed and help you, go through the day better. So exercise can also be helpful in that case. Mhm. Unless, of course, it's something pathological where you should take the advice of your doctor.
Mhm. Okay. Thank you, Sarah. Hope that helps as well. And one more question, okay, from Sarah here. So, is a BMI of 32 an issue? Please be honest with me. Do I need to lose weight?
Okay, well, uh, if a BMI over 30 is an issue, yes, it can be an issue, and why is that? Because when our BMI is higher, this may cause problems regarding the stimulation, how the patient will react to the treatment. We may have pure response. And not only that, we face difficulties. We are a bit concerned because we will do the oocyte retrieval, which is a procedure. So definitely, we would prefer to have a BMI lower than 32. Nevertheless, Sarah, that doesn't mean that you cannot go for a treatment. It would be ideal if you could advise a dietitian and if you could start, as I mentioned also in my presentation, a realistic diet plan in order to be able, to regulate a bit your weight before you start treatment. It would definitely positively affect your treatment. And I think it's not easy, it's definitely not easy, but it can be done and it worth trying. You put some effort to that, you will put so much effort to that. So it would be great if you could try and follow a program that will help you lose weight.
All right. Thank you so much for that, Sarah. All the best, okay, to you, of course. Hope that helps as well. And yeah, this is the answer from Sarah. Let me show you. Thank you very much. Very helpful. I do my best. Fingers crossed,
I'm
okay?
sure,
Best of
I'm
luck.
sure, I'm sure, Sarah, I'm sure.
Indeed. Okay, let's have a look. Liz has another question here. Can ovarian cysts prevent you from being successful with IVF?
Okay. Well, normally when we have ovarian cysts that the doctors will say that we don't like to have, yes, we postpone the treatment for next month. We do not want to have ovarian cysts, and depending on the morphology of the cyst, of course. I will repeat again that I'm not a clinician, I'm not a doctor, but because I have been collaborating with doctors as a fertility coordinator, yes, we want to avoid cysts because, yes, of course, they can negatively affect the treatment.
Okay, again, thank you so much. And of course, there's one more question in regards to also polyps. So, might be our final question. So, if you have more, you know what to do. Type those in right now, and let's have a look at this question. In the meantime, I have done hysteroscopy, and polyps were removed. My question: can polyps come back? If yes, how soon can they come back?
Yes, unfortunately, they can come back soon. Yes, it happens. It's good to remove them, of course, if the doctors feels that that this will not be good for the treatment. That's why doctors really advise to do the treatment as closer to the hysteroscopy as possible. Not to do, for example, a hysteroscopy and do the treatment 6 months later. So keep that in mind, and you better proceed if everything else is normal the soonest possible.
I hope that helped as well, Christina. Thanks so much for your question. And Liz has one more in regards to this. So, should an IVF cycle be cancelled if you have a cyst?
Well, from my experience, I see that we don't want cysts when we start. Of course, we need to evaluate the cyst we have before we make our final decision. I think that your fertility specialist will be able to evaluate the situation and give you the best advice. In many cases, though, we postpone the treatment for next month. We check again to see if the cyst is there, and if we feel that we are okay to start, then we do start the treatment again.
And of course, that makes perfect sense, I think. So thanks a lot, Liz, for your follow-ups as well. Okay, someone is typing, so let me have a look if we have more questions. If not, we will be finishing, but we still have time. So if you have more questions, go ahead, type those in. But as you can see, we already have some thank yous coming up your way. So thanks a lot for your answers. Thank you for answering all my questions. And I guess that was our final question. But of course, as always, I want to remind everyone that if you wish to ask anything, remember you can get in touch with Veatriki and her team at Assisting Nature. I'm more than sure that they will be happy to help you out with any questions in details, of course, as well. I know that doctors, the staff always needs more details, your medical history, etc. So remember, keep that in mind, of course. And I guess that was it. So, Veatriki, thank you so much for joining us tonight. It was lovely to have you here. And before I let you go, is there anything else you wish to say, to share with us?
Thank you so much for tonight. I would like to point out how important this is for all the women and all the couples that are considering having an IVF treatment. We will be more than happy to answer to any question that they may have. They can contact us via email. We will email them back. We will call them back if they want to. So feel free to contact us, and we will try and answer any question you may have.
There's no doubt here. So thanks a lot for that. And as you can see, more thank yous are coming up your way as well. I found your presentation helpful and given some things to focus on ahead of my next treatment. Best of luck to everyone as always. Okay, we always hope that you will be able to share with us all the happy, of course. Results, right? So we are always waiting for that. Thank you indeed. I want to also remind everyone that, as you know, we will be back. There are some more events coming up next week. On Tuesday, we will talk about egg donation failure and what to do to overcome this with Dr. Halina Strelkos. I hope you will be able to join us. We will start at 7 p.m. UK time as well. Thank you so much, Veatriki. It was lovely to have you, as I've mentioned. And this is your first webinar with us. So I'm glad that we were able to finally do it. I'm looking forward to some more events as well.
Thank you so much. Thank you so much. I hope it was helpful, and I'm sure that everyone will do its best. I hope for the best outcomes, more pregnancies and more babies for all the women who are trying hard, to get there.
Definitely. Thank you so much. I think it's the best summary. So thanks a lot indeed. Have a lovely evening, everyone. I hope to see you soon, and take care. Good night. Bye.
Take care. Bye-bye.